out of foster care and reforming the foster care system. But Senator Grassley, it's a pleasure to work with you, and I now yield the floor to my colleague, and we'll submit the rest to the record. Thank you, Mr. President.
Mr. President,
The distinguished senator from Iowa.
I appreciate the kind words of the senator from Louisiana, and likewise, it's a pleasure not only to work with her, but the two of us have been able on most foster care and adoption issues be able to find a broad coalition of senators that are very interested in making sure that people that don't have permanence because of the lack of adoption or because of faults within the foster care system, to bring changes in legislation that make that permanence and stability more a fact and a better quality life for the young people. So thank you, Senator Landrieu, for your leadership. And I likewise, as she has, rise to honor National Adoption Month. And so I would take a few minutes to discuss my support for Senate Resolution 302 and for policies that promote and encourage adoption. For years, I've championed efforts to increase awareness of adoption and help streamline the process for families who open their hearts and homes to children who have no other family. Senate Resolution 302 helps promote national awareness of adoption and the children awaiting families, celebrates children and families involved in adoption, and lastly, encourages the people of the United States to secure safety, permanency, and well-being for all children. As co-founder and co-chair of the Senate Caucus on Foster Youth, I've taken a keen interest in helping children who find themselves in the foster care system. In the United States today, more than 400,000 children live in the foster care system. Many of these children have been welcomed into adoptive homes. However, over 105,000 of those in foster care are still waiting to be adopted. According to the Administration of Children and Families in my home state of Iowa, more than 4,700 kids entered the foster care system last year. A total of 6,500 kids were in my state's foster care system in 2010. Foster youth simply desire to have what so many of us were blessed to have, that is, a home with caring, loving parents and siblings. In other words, in a short statement, they want permanency. They want stability. Too many older children in foster care, especially those with special needs, are often the ones who wait the longest to leave foster care. These kids are less likely than younger children to find what we refer to as forever homes. While research shows that 40% of the Americans have considered adopting, many are reluctant because they are unsure of the adoption process. They have inaccurate perceptions about the children who are eligible to be adopted. Some believe that children in foster care are there because of delinquency and other behavioral problems. The unfortunate fact is that most children who are in foster care are there because they are abused, neglected, or abandoned. These vulnerable children desperately need a family structure. They need parents who serve as a positive role models, helping them become bright and successful members of their community. While progress is being made to increase adoption, there is always more work to be done. Helping in this process are numerous agencies and nonprofit organizations who work tirelessly to find worthy American families who want to be adopting parents. In Iowa, one such agency is Four Oaks Family and Children Services of Cedar Rapids, Iowa. Four Oaks has had a recruiter working with Wendy's Wonderful Kids since 2005. Wendy's Wonderful Kids is an innovative program of the Dave Thomas Foundation for Adoption, named after the late American business icon who founded Wendy's restaurants. The foundation mission is to promote adoption. It recently released a report about the success of the Wendy's Wonderful Kids program. Specifically, the program is more focused on hard-to-place children. Recruiters work with children to find them the most appropriate placement. This program is a success story. Congress has also adopted and acted on legislation. In 2008, I was part of a bipartisan effort to pass the Fostering Connections to Success and Increasing Adoptions Act of 2008. This new law represented the most significant and most far-reaching improvement in child welfare in over a decade. It provided additional federal incentives for states to move children from foster care to adoptive homes. It included legislation that I had introduced to make it easier for foster children to be permanently cared for by their own relatives, including grandparents, aunts, and uncles, and to stay in their home communities. And that, of course, is one way of bringing about greater stability. Provisions in the law also made all children with special needs eligible for federal adoption assistance. Previously, that assistance had been limited to children who were removed from very low-income families. The law broke new ground by establishing opportunities to help kids who age out of foster care system at age 18 by giving their respective states the option to extend their care and by helping them pursue education or vocational training. In late 2009, Senator Mary Landrieu and I formed the Senate Caucus on Foster Youth to give older youth in and out of care and their families a place where their voices could be heard. We wanted foster youth to be part of this legislative process by hearing from young people and from their families who have experienced the foster care system firsthand. Congressional leaders will become more aware of the issues facing young people and their families. The caucus has and will continue to generate new ideas to prevent negative outcomes and create new opportunities for success. We wanted to focus on helping young people when they age out of the foster care system, typically at age 18. As many as 29,000 children age out every year without ever having found adopted placement. And without the security of a family, they often end up homeless, end up incarcerated, and end up maybe addicted to drugs. Children who age out of the system enter adulthood without knowing what it was like to be raised having their own families because they were under the state's supervision, and in a sense the state was their family, and that's not much of a family. They missed out on having a mom and a dad, and maybe brothers and sisters to grow up with and to learn from, and whom they would have relationships with for the rest of their life. They missed out on a very important part of childhood that they will never know, one that too many of us take for granted. They're thrown into the world by themselves and forced to take care of themselves. They struggle to pay bills, to find and hold a job, and simply make ends meet. That is why adoption awareness is so very important, and hence the resolution that we are talking about. Since the first National Adoption Day in 2000, more than 35,000 children have joined Forever Families during National Adoption Day. In 2010 alone, adoption for almost 5,000 children were finalized through 400 National Adoption Day events in all 50 states, the District of Columbia, and Puerto Rico. These are impressive numbers, numbers that make us proud of the work being done to help foster children get the proper care. But there is always more work to be done. And I've said that twice, and you can't say it too many times. And it is through awareness like this that we can help the work to continue. In passing Senate Resolution 302, this body will make an important statement about our collective support for the needs of foster children. It recognizes the families who took the giant leap to open their homes to other children. National Adoption Month is about kids who need a home. It's about kids who just want a mom and a dad. It's about helping children who are victims of neglect and abuse. It's about giving children living in foster care the ability to live their dreams. We need to keep working together to break down the barriers to adoption so every child feels the relief of a solid family. I'm proud to support the many kids who wait for permanency and stability, but more importantly, you also have to salute the many organizations that are helping to make their dreams come true. I yield the floor, and I suggest the absence of a quorum.
The clerk will call the roll.
Mr. Akaka.
Because of the attack against Congresswoman Gifford, there has been some legislation introduced for more gun control, and we're always going to have to take a good look at that piece of legislation, like we have unanimously passed legislation after the tragic shooting in Virginia Tech in April of 2007. I'm not going to deal directly with that specific piece of legislation, but I'd like to talk about some of the general approaches to gun control that's being discussed. Getting back to Virginia Tech, the national debate surrounding updating federal gun laws gained national attention following the tragic shooting at Virginia Tech. And now, of course, has come up against because of the attack against Congresswoman Gifford. Following the terrible tragedy at Virginia Tech, Congress passed the National Instance Criminal Background Check System, and that goes by the acronym of NICS, N-I-C-S. So I'll be referring to the National Instant Criminal Background Check by that acronym. This bill, as I just said, passed the House and the Senate by unanimous consent and was signed into law by President Bush. Despite the strong bipartisan support that the NICS Improvement Act had, the Improvement Act was not a perfect piece of legislation and is a good example of why we need to be very careful when we legislate to avoid unintended consequences. And so I'm raising some of these issues in regard to the possible consideration of legislation that's been introduced because of the terrible attack on Congresswoman Gifford. For example, in the next bill, it actually, with unintended consequences, but still doing it, stripped thousands of veterans and their beneficiaries of their Second Amendment rights simply because they had a fiduciary appointed on their behalf. Oftentimes, a fiduciary is appointed simply for managing disability compensation, pensions, or survivor benefits. Under an interpretation by the Department of Veterans Administration, veterans who have a fiduciary appointed are often deemed, quote-unquote, mentally defective, and are then consequently reported to the FBI's NICS system and consequently prohibited from purchasing a firearm. Under the NICS Improvement Act, and that was a bipartisan bill, with unintended consequences, this happened. Around 114,000 veterans and their beneficiaries have been automatically denied their Second Amendment rights. It is a terrible irony that veterans who have served their country on the battlefield, who have been entrusted with our national security and have been provided firearms by their very government, are the same people that the NICS Improvement Act harmed by taking away their Second Amendment rights, all without a hearing or formal adjudication. Now, we just honored and celebrated Veterans Day last Friday, yet we are possibly going to be debating new legislation to restrict the Second Amendment rights of citizens without fixing the unintended consequences of our last major gun law, that NICS Improvement Act. While the horrific events in Tucson are still fresh in our memories, as we discuss new gun control laws, we also need to move forward on bipartisan legislation such as the Veterans Second Amendment Protection Act, introduced by a bipartisan couple, Senators Burr and Senator Webb. This bill would fix the unintended consequences to thousands of veterans caused by the NICS Improvement Act. At a hearing we had this week, it offered me an opportunity to discuss illegal firearms tracking and the government's efforts to stop it. At the forefront of this is the Department of Justice's failed operation called Fast and Furious, where the ATF knowingly allowed illegal purchasers to buy guns. The more we learned about Fast and Furious, the more we have discovered that senior Justice Department officials knew or should have known about these nearly 2,000 guns ending up in the hands of criminals, including the drug cartels in Mexico. At the first House Oversight hearing on Operation Fast and Furious, multiple ATF agents testified that fear spread through Phoenix Field Division every time there was news of a major shooting event. So that brings us back to the tragedy for Congresswoman Gifford. Specifically with regard to the Congresswoman's shooting, one agent said, quote, "There was a state of panic, like, let's hope this is not a weapon from that case," end of quote. And that case was a Fast and Furious case where our government decided to encourage licensed gun dealers to illegally sell guns to straw purchasers with the idea that we'd follow them across the border. But there wasn't any following. So it was an effort doomed to failure in the first place. The Fast and Furious operation was failed in concept, in design, and in execution. As the Attorney General said last week before our Judiciary Committee, it should never have happened. And the Justice Department officials that knew about this program, including those who allowed false statements to Congress, need to be held accountable. I thought it was fitting that late last week, Attorney General Holder finally wrote to the family of Agent Terry, the person that was murdered with two of these Fast and Furious guns found at the murder scene. And this is the very same Attorney General that had an opportunity to apologize to the Terry family when he was asked by Senator Cornyn, do you want to have you apologize to the Terry family? And the Attorney General said no, and he said, would you like to apologize now? That's what Senator Cornyn asked him. And he gave an answer, but it wasn't an apology. So we have a letter late last week going to the Terry family. In his letter, he stated he was sorry for their loss, although he refused to take responsibility for the department's role in Agent Terry's death. At the root, then, of Fast and Furious and a lot of rhetoric surrounding gun control legislation has been the gun trafficking statistics provided by ATF. These unclear statistics have fueled the debate and contributed to undertaking such a reckless operation as Fast and Furious. For example, in 2009, both President Obama and Secretary of State Clinton stated that 90% of the guns in Mexico were from the United States. But that statistic later changed to 90% of the guns that Mexico submitted for tracing to the ATF were from this country. And now, this year, that number has become 70% of the guns submitted by the Mexican government for tracing were from the United States. Now, you know, all that different percentages begs the question, what are the real numbers? Articles discussing the 70% number misrepresent the facts, as I pointed out in a letter to then ATF Acting Director Melson in June this year. First, there are tens of thousands of guns confiscated at crime scenes annually in Mexico. The Associated Press stated that in 2009, over 305,424 confiscated weapons are locked in vaults in Mexico. However, the ATF has acknowledged to my staff in a briefing on July the 29th, 2011, that ATF does not have access to the vault in Mexico described in that story. ATF also acknowledges that only a portion of the guns recovered in Mexico are actually submitted to the United States for tracing. In a November 8, 2011 court filing, the chief of ATF's Firearms Operation Division made a declaration saying, now remember, this is in a court filing, quote, "It is important to note, however, that ATF's e-trace data is based only on gun trace requests actually submitted to the ATF by law enforcement officials in Mexico and not on all of the guns seized in Mexico," end of quote. That court filing further states that in, quote, "In 2008, of the approximately 30,000 firearms that the Mexican Attorney General's office informed ATF that it had seized, only 7,200, or 1/4 of those firearms, were submitted to ATF for tracing." So, if Mexico submits only 25% of the guns for tracing, then the statistics could be grossly inaccurate one way or the other. The discrepancies in the numbers do not stop there. ATF also informed my staff that the e-trace-based statistics could vary drastically by a single word's definition. Now, we have an example of different definitions. The 70% number was generated using a definition of U.S.-sourced firearms. That happens to include guns manufactured in the United States or imported through the United States. Thus, the 70% number does not mean that all guns were purchased at a U.S. gun dealer and then smuggled across the border. It could simply mean that the firearm was manufactured in the United States. So, when my staff asked ATF how many guns traced in 2009 and 2010 were traced to U.S. gun dealers, the numbers were quite shocking in comparison to the statistics we've previously heard. In 2009, of the 21,313 guns recovered in Mexico and submitted to tracing, only 5,444 were sourced to a U.S. gun dealer. That's around 25%. For 2010, of the 77,971 guns recovered in Mexico submitted for tracing, only 2,945 were sourced to a U.S. gun dealer. That's only 37%, far cry from 70%, a far cry from the 90% that we've been hearing over a long period of time. Not to mention that the guns in 2009 and 2010 from gun dealers could include some of the nearly 2,000 firearms that were walked as part of our own Justice Department's Operation Fast and Furious. We need clearer data from ATF and from Mexico. Mexico needs to open up the gun vaults and allow more guns to be traced, not just the ones that the Mexican government selects. We need to know if military arsenals are being pilfered as a source, as media articles have claimed the State Department points to in diplomatic cables. So when it comes to the diplomatic cables, I sent a letter today to, or actually it was yesterday, to Secretary of State Clinton seeking all diplomatic cables discussing the source of arms from Mexico, Central America, and South America. I believe this information is relevant to Congress, given that I discovered in July 2010 cable as part of my Fast and Furious investigation. That cable, titled, quote, Mexico Weapon Trafficking, the Blame Game, end of quote, seeks to dispel myths about weapons trafficking. Among other things, the State Department authors discussed what they perceived as, quote, myth, an iron highway of weapons flows from the U.S., end of quote. These cables are vitally important to Congress's understanding of the problem. Further, given they appear in documents that ATF submitted to Congress as part of Fast and Furious, there should be no reason for the State Department to withhold them as part of our legitimate oversight, even if they are classified. There's a lot more to be said about the specific problems with the legislation that we might be coming before the Judiciary Committee as a result of Congresswoman Gifford's tragedy. We have to ask a lot of questions to flesh out some of these serious problems, because we don't want to happen in this legislation what happened in the NICS Improvement Act, when 114,000 veterans are denied their Second Amendment rights, and consequently avoid these unintended consequences. And we should not be legislating away any constitutional rights that people have under the Second Amendment. I yield the floor and suggest the absence of a quorum.
The clerk will call the roll.
Mr. Akaka. Speak very long tonight, and I'm not going to speak very formally either. But I did want to come back to the Senate floor and make a point again that I have made repeatedly here on the Senate floor before, and that is that there is a path to reform of our health care system that will improve the quality of care for patients, will improve the experience of care for patients, will improve the outcomes of care for patients and for our nation, and will lower costs for our country. And the reason that I come to raise that point again is that the Senate is now awash with rumors that the 12 members of Congress, senators and congressmen who have been tasked with trying to create a solution to our deficit problem are going to cut Medicare benefits by hundreds of millions of dollars. That is, as best I can tell, only a rumor. I certainly can't vouch for it being true. Indeed, I hope it is not true. And the time I would like to spend this evening is to remind my colleagues that it is a very unfortunate and mistaken path to take to follow the road of benefit cuts at a time when the road to reform is so promising in terms of the win-win of better care and lower cost. And it's not just me saying this. The President's Council of Economic Advisors has said that the annual savings that could be accomplished with a health care delivery system reform without reducing anybody's quality of care or access to care, indeed I would hypothesize actually improving quality of care, is $700 billion a year in the American health care system. And the President's Council on Economic Advisors is not alone in that opinion. The Institutes of Medicine have just said that it's around $770 billion a year. A few years back, the New England Health Care Institute said that it was $850 billion a year. And the Lewin Group, which is a fairly well-respected health care consultancy here in Washington, as well as George Bush's Treasury Secretary, Secretary O'Neill, have both agreed that the annual savings could be $1 trillion a year, all by improving the quality of care and the coordination of care. And I don't know if it's exactly going to be $700 billion or $1 trillion, but my point here is that there is a really big savings target out there that everyone from President Obama's Council of Economic Advisors to George Bush's Treasury Secretary to a lot of very well thought of groups in between, including our National Institutes of Medicine, all agree on. So I think that that makes it a very important target to pursue in this discussion. And it's not just me in believing that at this potential split in the road, we should work and fight very hard to make sure we're taking the right path and that we don't go down the easy-to-score but unnecessary and unhelpful path of benefit cuts which single out seniors in Medicare and do nothing about the underlying cost of the system and make it the wrong road to follow when we have a really well-illuminated path that can move us towards a better, more efficient delivery system that provides better quality health care, better outcomes, fewer hospital-acquired infections, better coordinated care, stronger electronic health records, all of the things that will support a truly modern health care system that can be the envy of the world. That's the choice that we have. And I think it would be a terrible mistake to go the benefit cuts route instead of the reform route. And it's not just me who says that. George Halverson is the Chief Executive Officer, the CEO of Kaiser Permanente. Kaiser Permanente is one of the biggest health care systems in the country. It provides health care in many, many states, and George Halverson is a very serious individual who knows his stuff in health care. He would not be the CEO of that very big company if he did not. Here's what he said the other day. There are people right now who want to cut benefits and ration care and have that be the avenue to cost reduction in this country. And that's wrong. It's so wrong, he said, it's almost criminal. It's an inept way of thinking about health care. That's not me. That's the CEO of Kaiser Permanente. There are people right now who want to cut benefits and ration care and have that be the avenue to cost reductions in this country, and that's wrong. It's so wrong, it's almost criminal. It's an inept way of thinking about health care. And yet that is the direction that it looks like we may be taking, the inept direction. I had a hearing in the Health Committee. The presiding officer, Senator Bennett of Colorado, is a member of that Health Committee. And we had some very interesting witnesses, because the path towards savings through reform isn't just a hypothetical path. This is not something that some academic has constructed and maybe if you take that path things will work. This is a path that major corporations, major health systems, major hospitals in this country are already walking. They are already walking down that path. Kaiser is one of them. Blue Shield of California is another. Intermountain out in the West is a third. Mayo, Geisinger, Gunderson Lutheran. There are a number along the East Coast. And these are companies that have determined that this is the right path, and they're walking that path. And two folks were there from such companies. One was Dr. Gary Kaplan, who is at the Virginia Mason Health System in Seattle, Washington. Despite its name, Virginia Mason, it's actually in Seattle, Washington on the other coast. And he pointed out that they went through a quality management transformation in their hospital. It was a cultural transformation. It was a process transformation. And as a result, they have made significant improvements. Just in one back pain reform process that they did, with 2,000 patients, they calculated that they've already saved $1.7 million on 2,000 back pain patients, and those patients are happier with the new regime, the less expensive regime, than before, because they're getting better quality care. He testified that they saved $11 million in planned capital investment, reduced inventory costs by $2 million through supply chain expense reduction, reduced staff walking distance by 60 miles per day, reduced labor expense in overtime and temporary labor by $500,000 in just 1 year, reduced professional liability insurance premiums by 56%, reduced their self-insured retention fund by 70%, reduced the time it takes to report lab tests by more than 85%, and improved their medication distribution, reducing errors, reducing the time when a patient first calls Virginia Mason's breast clinic with a concern to the time that they receive a diagnosis from 21 days to 3 days. And many patients receive their results on the same day. These are the kind of improvements that have put Virginia Mason at the front end and make them, according to the Leapfrog Group, one of the top hospitals in the country. They are walking the walk of improving the quality of their operations, improving the quality of the care, and saving money by doing so. The other witness was Greg Polson from Intermountain. He described two examples. One was a sepsis program for people who were admitted to the hospital suffering from sepsis throughout their system. Sepsis is a dangerous condition. Sepsis, on average, has a 40% mortality rate. So 4 out of 10 people with sepsis die of it. They have reduced the 40% mortality rate from sepsis to 5%, from 4 in 10 dying to 1 in 20 dying. Did it cost a lot of money to do that? Was that a big investment that they had to make? Did it cost the taxpayers a lot to save those lives? No. What they found is that they saved $10 million with that improvement. Similarly, they have a diabetes program that has been described by the former CEO of the Mayo Clinic as the diabetes program that he would go to if he were sick with diabetes, that has the, quote, best outcomes and lowest cost. Best outcomes and lowest cost in the country. They saved $5 million a year on diabetes treatment by going to better health care providing. Now, there is a problem, as he pointed out. That $10 million that they saved is actually a revenue loss. Because when they save money by not having unnecessary care, by not having complications, by having things be more efficient and streamlined, what they do is they reduce their billing to the insurance companies. And it's actually the insurance companies, it's the payers who save the $10 million. What the providers experience is a revenue loss. So we have our system upside down in that respect. And that's one of the ways that we need to reform our system. A third witness who was there was a Rhode Islander. His name is Chris Kohler. We have a unique office in Rhode Island, an Office of Health Insurance Commissioner. He's the one health insurance commissioner in the country. I also tease him that he's the tallest health insurance commissioner in the country because he's unusually tall, but that's easy because he's the only one. But he's done a very good job at bringing our hospitals and our insurance companies together to try to focus on the ways that we can deliver care better. One way is through prevention and primary care. Turned out that in Rhode Island, the amount of every health care dollar that was spent on primary care was 5.9%. So every dollar spent on health care in Rhode Island, less than 6 cents went to primary care, went to your regular family doctor and the basic health care providers. Less than 6 cents out of every dollar. The insurance companies have more overhead than that, administering the system. The cost of administration of the health care system is more than the primary care providers get out of the system. That's another sign that the system is upside down. He's encouraging them, and they've agreed to step up the spending on primary care by 1% a year for 5 years. And we believe that that is going to make a very substantial cost savings because there's so much that a primary care provider can handle without having to go to a specialist, without having to go to the emergency room, without the condition getting worse because they couldn't find you, by simply making primary care more accessible and more available. And so the additional expense for primary care should bring down system costs overall and having it designed more intelligently. So I'll close with a few words from the witnesses. Dr. Kaplan said that through the work that they have been doing on reform and efficiency, he said, I quote, "We have demonstrated that the path to higher quality, safer care is the same path to lower costs." He actually said that if we could get more transparency into the system about who's doing a better job and who's not, what the outcomes are for different hospitals, that basically where we are right now and the delivery system reform provisions that were in the Accountable Care Act, he described them as one of the last chances of a market-based system. This is somebody who is in this business all the time and is actually running a hospital that is actually producing results. This is a person who is steeped in the reality of health care. And contrary to what we hear in the cartoon version that infects Washington, where Obamacare is socialized medicine and is a step away from market-based care, this practitioner says that the potential of the Accountable Care Act, as I see it, is as one of the last chances of a market-based system. It could actually lead to a market, whether it was Medicare and Medicare Advantage as part of Medicare or the commercial sector, that we would actually be able to understand what we're buying, what we're paying for. That's the kind of common sense transformation that we need. Similarly, Mr. Polson, you remember Dr. Kaplan said, we've demonstrated the path to higher quality, safer care is the same path to lower costs. Here's Gary Polson. Intermountain and other organizations have shown that improving quality is compatible with lowering costs, and indeed, high-quality care is generally less expensive than substandard care. And the primary challenge for us, and the main reason more organizations don't adopt the high-value models discussed in the hearing that we held, is the underlying fee-for-service payment system, which predominates, of course, in the United States. We pay doctors for doing more, not for doing better. We pay doctors for doing more things to you rather than getting you well. And because we do that, we have the results we have. Now, when you look at that mess, you can say, okay, we're going to leave all of that alone. We're not going to follow the path that Intermountain has proven, that Gunderson Lutheran has proven, that Virginia Mason has proven, that Kaiser has argued for and proven, that so many systems around this country are doing. You could say, we're going to forget all that. We're going to leave it in place. We're going to leave it a mess. And we're just going to cut benefits away from seniors, from our elderly, from the people who need care the most, from the people who paid into the system, from the people who don't have a chance to recover, very often from people who really aren't in a position to direct their own care and make effective choices if they're the very elderly on Medicare, or worse, the Medicaid, Medicare dual eligible. We're going to go after those people. We're going to cut their benefits. And we're not going to take the trouble to follow the path that the professionals who are doing this are already showing is the path that leads to savings, is the path that leads to a better health care system, is the path that leads us out of the difficult position of being the only country in the world that spends 18% of our GDP on health care, of being the most inefficient country in the world in health care by a 50% margin. The next closest country in terms of inefficiency in health care is about 12% of GDP. We're at 18. Why is it necessary that America has to be the most inefficient health care provider in the world of all the countries we compete with by a factor of nearly 50%? Half again worse than the most inefficient competitor we face. It makes no sense to be in that position. There is enormous room for improvement. The path to that improvement is clear. It is already being walked by serious and responsible institutions who have set this as their corporate goal, and that is where we should go. I'll close again by repeating George Halvorson's exhortation. He's one of the great healthcare leaders in this country. He is a savvy corporate manager. He runs an enormous healthcare corporation. This is not an idle opinion of his. There are people right now who want to cut benefits and ration care and have that be the avenue to cost reduction in this country, and that's wrong. It's so wrong, it's almost criminal. It's an inept way of thinking about health care. Those are CEO George Halvorson's words, not mine. I hope that they ring through this body and that we do not make the mistaken decision to go after Medicare benefits and instead take the positive path of reform and improvement. I thank the presiding officer. I yield the floor and suggest